Have you ever started your morning the same way you've done for years without giving it a second thought? What if that seemingly harmless habit was quietly placing extra strain on your heart every single day? Cardiologists are increasingly concerned that millions of adults, especially those over 50, continue doing one common morning routine without realizing the potential risks involved. In today's video, you'll discover what happens inside your body during the first moments after waking, why this habit can become more dangerous with age, and what simple changes may help protect your heart and potentially lower your risk of serious cardiovascular problems. Stay with us, because what you're about to learn could change the way you start every morning. Every morning, millions of people wake up and immediately jump out of bed to start their day. It feels natural, efficient, and harmless. Whether it's rushing to the bathroom, checking the phone, making coffee, or getting ready for work, many people move from a lying position to standing within just a few seconds. Because this habit is so common, most people never stop to question whether it could affect their health. However, cardiologists have been paying closer attention to what happens inside the body during those first moments after waking, especially in older adults. While you sleep, your body operates differently than it does during the day. Your heart rate typically slows, your blood pressure changes, and your circulation adapts to a resting state. During these hours, the cardiovascular system is working under a different set of conditions designed to support recovery and rest. When morning arrives, the body must transition from this resting state to an active one. This adjustment is not always instantaneous, and it can place temporary stress on the heart and blood vessels. The moment a person stands up suddenly after lying down for several hours, gravity causes blood to shift toward the lower parts of the body. In response, the heart must work harder to maintain adequate blood flow to the brain and other vital organs. Most healthy individuals adjust quickly without noticing any symptoms. However, as people age, these natural adjustment mechanisms may become less efficient. Blood vessels can become less flexible, and the body's ability to regulate blood pressure may not respond as rapidly as it once did. For adults over 50, the risks associated with sudden morning movements can become more significant. Aging often brings changes to the cardiovascular system that may not be obvious during everyday activities. Arteries can gradually stiffen, circulation may become less efficient, and existing conditions such as high blood pressure, diabetes, or heart disease can increase vulnerability. In these situations, getting out of bed too quickly may lead to a temporary drop in blood pressure, reduced blood flow to the brain, or additional strain on the heart. Many people have experienced brief dizziness or lightheadedness after standing up quickly. They may dismiss it as a normal part of aging or assume it happens because they skipped breakfast. In reality, these symptoms can be signs that the body is struggling to adjust to sudden changes in position. Even when symptoms disappear after a few seconds, they may indicate that the cardiovascular system is working harder than expected during the early morning hours. Research has shown that the morning period is already a time when the body experiences natural increases in stress hormones, blood pressure, and heart activity. These changes help prepare the body for the day ahead. When combined with abrupt movements immediately after waking, they may create additional demands on the cardiovascular system. This is one reason why heart-related events such as heart attacks and strokes are more commonly reported during the morning hours compared to other times of the day. Because the habit of jumping out of bed is so deeply ingrained, many people continue doing it without ever considering the impact it may have on their heart health. The routine often begins in childhood and continues for decades, becoming an automatic part of daily life that rarely receives a second thought. The first hour after waking is one of the most active and important periods of the day for your cardiovascular system. Although you may feel as though your body simply transitions from sleep to wakefulness, a series of complex physiological changes begins almost immediately. During this time, your heart, blood vessels, hormones, and nervous system work together to prepare you for physical and mental activity. For many people, these changes occur smoothly and without noticeable symptoms. However, understanding what happens inside the body during this period can reveal why cardiologists pay close attention to the morning hours. While you sleep, your body enters a restorative state. Heart rate generally slows, blood pressure drops, and the heart requires less oxygen than it does during the day. This reduction in cardiovascular workload allows the body to recover from daily stress and activity. Blood vessels remain relaxed, and circulation is adjusted to support rest. Throughout the night, the cardiovascular system operates under conditions that are very different from those experienced during waking hours. As morning approaches, the body begins preparing for wakefulness even before your eyes open. The brain signals the release of hormones such as cortisol and adrenaline. These hormones are often referred to as stress hormones, but they serve an important purpose. They help increase alertness, boost energy levels, and prepare the body for movement. At the same time, these hormonal changes begin affecting the cardiovascular system. One of the first changes is a gradual rise in blood pressure. During sleep, blood pressure typically reaches its lowest levels. After waking, it begins to climb as the body shifts into an active state. This increase is known as the morning blood pressure surge. For healthy individuals, this process is a normal part of the body's daily rhythm. However, the surge can be more pronounced in older adults and people with hypertension, potentially placing extra stress on the arteries and heart. Heart rate also begins to increase during the first hour after waking. As adrenaline levels rise, the heart starts beating faster to deliver more oxygen-rich blood throughout the body. This increase helps support muscles, organs, and brain function as activity levels rise. The heart must adapt quickly to changing demands, especially when a person gets out of bed, begins walking, or starts morning tasks shortly after waking. The blood itself also undergoes subtle changes during the morning hours. Studies have shown that blood can become slightly more prone to clotting after waking. Platelets, the cells involved in blood clot formation, may become more active during this time. While this is a natural biological process, it helps explain why cardiovascular events such as heart attacks and strokes occur more frequently in the early morning. When increased blood pressure, faster heart rate, and heightened clotting activity occur together, the cardiovascular system faces a period of increased vulnerability. Another important factor involves the body's autonomic nervous system, which controls many automatic functions, including heart rate and blood vessel constriction. Upon waking, the sympathetic nervous system becomes more active. This system is often described as the body's fight or flight response. Its activation causes blood vessels to narrow slightly and encourages the heart to pump more forcefully. These changes help the body become alert and ready for the day, but also increase cardiovascular workload. For individuals with healthy arteries and strong cardiovascular function, these morning adjustments are usually managed efficiently. However, people with existing heart disease, narrowed arteries, high blood pressure, or other cardiovascular conditions may experience greater strain as the body navigates these rapid physiological changes. As aging occurs, blood vessels gradually lose some of their elasticity. Healthy arteries are designed to expand and contract in response to changing blood flow demands. Over time, however, arterial walls can become stiffer. This reduced flexibility means the cardiovascular system may not adapt as quickly when a person suddenly moves from lying down to standing. The heart often has to work harder to maintain proper circulation throughout the body. Another common age-related change involves blood pressure regulation. The body relies on specialized sensors known as baroreceptors to detect changes in blood pressure and signal adjustments when necessary. These sensors help ensure that adequate blood flow reaches the brain when a person changes position. As people get older, the sensitivity of these receptors may decline. As a result, the body may take longer to correct sudden drops in blood pressure that occur after standing up quickly. Balance and coordination may also change with age. Even a brief episode of dizziness can increase the risk of losing balance or falling. Falls are a major health concern among older adults because they can lead to fractures, head injuries, reduced mobility, and lengthy recovery periods. What begins as a simple rush to get out of bed can sometimes create circumstances that increase the likelihood of an accident. The combination of less flexible arteries, slower blood pressure adjustments, underlying medical conditions, medication effects, balance concerns, and changes in sleep patterns creates a situation in which abrupt morning habits may carry greater risks than many people realize. One of the most common warning signs is dizziness immediately after standing up. Many people experience a brief sensation that the room is spinning or that they feel unsteady on their feet. This can occur when blood pressure temporarily drops and the brain receives less blood flow than it needs. Although the feeling may last only a few seconds, frequent episodes can suggest that the body is struggling to regulate circulation efficiently. Lightheadedness is another symptom that deserves attention. Unlike dizziness, which often involves a sensation of spinning or movement, lightheadedness may feel more like weakness, faintness, or the sensation that a person might pass out. Some individuals describe it as feeling disconnected or mentally foggy for a short period after getting out of bed. These episodes may occur because the cardiovascular system is not responding quickly enough to sudden changes in body position. Blurred vision can also be a sign of temporary circulation issues. The eyes require a constant supply of oxygen-rich blood to function properly. When blood flow decreases even briefly, vision may become blurry, dim, or unfocused. Some people notice dark spots, tunnel vision, or a temporary loss of visual clarity when they stand up too quickly. While these symptoms often resolve within moments, they indicate that the body's adjustment mechanisms may be under strain. Unusual fatigue during the morning can sometimes signal that the heart is working harder than expected. Feeling tired after a poor night's sleep is common, but persistent exhaustion despite adequate rest may warrant closer attention. When the cardiovascular system struggles to deliver oxygen efficiently throughout the body, a person may experience reduced energy levels, weakness, or difficulty performing routine morning activities. Heart palpitations are another potential warning sign. A palpitation is the sensation of feeling your heartbeat more strongly, rapidly, or irregularly than normal. Some people describe it as fluttering, pounding, racing, or skipping beats. While palpitations can occur for many reasons, including caffeine consumption and stress, repeated episodes during the morning hours may indicate that the heart is responding to sudden demands placed upon it after waking. Shortness of breath should also be taken seriously. If simple activities such as getting out of bed, walking to another room, or climbing a few steps leave a person unusually breathless, it may suggest that the heart and lungs are not working together as efficiently as they should. The body depends on adequate circulation to transport oxygen to tissues, and difficulty breathing can sometimes reflect cardiovascular strain. Chest discomfort is among the most important symptoms to recognize. This discomfort may not always feel like severe pain. Some individuals experience pressure, tightness, heaviness, squeezing, or an unusual sensation in the chest. In certain cases, discomfort may spread to the shoulders, arms, neck, jaw, or upper back. Any recurring or unexplained chest symptoms deserve prompt medical evaluation, particularly in adults with risk factors such as high blood pressure, diabetes, or a history of heart disease. Frequent headaches during the morning hours can also be associated with blood pressure fluctuations and changes in circulation. While headaches have many possible causes, recurring morning headaches may reflect underlying cardiovascular or sleep-related issues that affect the body's ability to regulate blood flow effectively. 5 healthier alternatives recommended by cardiologists. Cardiologists often emphasize that protecting heart health does not always require dramatic lifestyle changes. In many cases, small adjustments to everyday routines can make a meaningful difference. One of the simplest changes involves how a person begins the day. Instead of rushing out of bed the moment they wake up, many heart specialists recommend allowing the body a few moments to transition gradually from sleep to full activity. This gentle approach can help reduce sudden stress on the cardiovascular system and support more stable circulation. A commonly recommended practice is to sit on the edge of the bed for a minute or two before standing. This brief pause gives the body time to adjust to the change in position. During this period, blood pressure and circulation can begin adapting gradually rather than being forced to respond instantly. For older adults or individuals who have experienced dizziness in the past, this simple habit may help reduce feelings of lightheadedness and improve balance. Taking a few slow, deep breaths after waking can also be beneficial. Deep breathing helps activate the body's relaxation response and may support healthy circulation. As oxygen enters the lungs, it is transported throughout the bloodstream to tissues and organs. Controlled breathing can encourage a calmer transition into the day while allowing the cardiovascular system to adjust at a more comfortable pace. Many cardiologists encourage gentle movement before standing fully upright. Small actions such as stretching the arms, moving the ankles, flexing the feet, or lightly bending the knees while still in bed can help stimulate blood flow. These movements activate muscles that assist circulation and prepare the body for greater activity. They also help reduce stiffness that often develops during several hours of sleep. Hydration is another important factor in supporting cardiovascular health during the morning. The body naturally loses fluids overnight through breathing and perspiration. As a result, mild dehydration may be present upon waking. Drinking a glass of water shortly after getting out of bed can help replenish fluids and support healthy blood volume. Proper hydration contributes to efficient circulation and may help reduce some symptoms associated with sudden blood pressure changes. Avoiding an immediate rush into physically demanding activities is another recommendation frequently given by heart specialists. Some people wake up and quickly begin carrying heavy objects, climbing stairs, exercising intensely, or tackling stressful tasks. Giving the body time to wake up fully before engaging in strenuous activity allows the cardiovascular system to adapt more comfortably to increasing demands. Morning exposure to natural light can also support healthy daily rhythms. Sunlight helps regulate the body's internal clock and encourages a smoother transition from sleep to wakefulness. Opening curtains, spending a few minutes outdoors, or sitting near a bright window may help the body synchronize its natural hormonal patterns. These adjustments can contribute to overall cardiovascular and metabolic health. For individuals who consume caffeine, cardiologists often suggest moderation and awareness of timing. Coffee and other caffeinated beverages can increase heart rate and temporarily raise blood pressure. While caffeine is safe for many people, consuming large amounts immediately upon waking may add to the cardiovascular changes already occurring during the first hour of the day. Some individuals may benefit from drinking water first and allowing the body time to adjust before consuming caffeinated beverages. Maintaining consistent sleep habits is another valuable strategy. A regular sleep schedule supports healthy blood pressure regulation, hormone balance, and cardiovascular recovery. Going to bed and waking up at similar times each day can help the body's internal systems function more predictably, making morning transitions smoother and reducing unnecessary strain on the heart and circulation. 6 simple daily changes that may reduce heart attack and stroke risk. Protecting the heart often begins with small, consistent habits practiced every day. Many people assume that reducing the risk of heart attacks and strokes requires major lifestyle overhauls, but cardiologists frequently emphasize the power of simple daily choices. When healthy habits are repeated over months and years, they can have a significant impact on cardiovascular health. The key is consistency rather than perfection. One of the most important daily changes involves monitoring and managing blood pressure. High blood pressure is often called a silent threat because it can damage blood vessels without causing noticeable symptoms. Over time, uncontrolled blood pressure increases the risk of heart attacks, strokes, heart failure, and kidney disease. Regular blood pressure checks can help individuals stay informed about their cardiovascular health and identify potential problems before they become serious. Physical activity is another cornerstone of heart protection. The heart is a muscle, and regular movement helps keep it strong and efficient. Activities such as walking, cycling, swimming, gardening, or light aerobic exercise encourage healthy circulation and support blood vessel function. Even moderate activity performed consistently can help lower blood pressure, improve cholesterol levels, and reduce strain on the cardiovascular system. Healthy eating habits also play a major role in reducing cardiovascular risk. Many heart specialists recommend focusing on nutrient-rich foods such as vegetables, fruits, whole grains, legumes, nuts, seeds, and lean protein sources. These foods provide vitamins, minerals, fiber, and antioxidants that support overall health. Reducing excessive intake of highly processed foods, added sugars, and unhealthy fats may help maintain healthier cholesterol levels and support proper blood vessel function. Maintaining a healthy weight can further reduce stress on the heart. Excess body weight often forces the cardiovascular system to work harder to supply oxygen and nutrients throughout the body. Even modest weight loss in individuals who are overweight may improve blood pressure, blood sugar control, and cholesterol levels. Small, sustainable dietary and activity changes often produce better long-term results than extreme short-term approaches. Managing blood sugar is particularly important for reducing stroke and heart attack risk. Elevated blood sugar levels can damage blood vessels and increase inflammation throughout the body. Individuals with diabetes or prediabetes benefit from regular monitoring, healthy eating patterns, physical activity, and following medical advice to keep blood sugar within recommended ranges. Quality sleep is another factor that is sometimes overlooked. During sleep, the body repairs tissues, regulates hormones, and allows the cardiovascular system to recover from daily demands. Consistently poor sleep has been linked to high blood pressure, obesity, diabetes, and increased cardiovascular risk. Establishing a regular bedtime routine and prioritizing adequate sleep may contribute to better heart health over time. Stress management is equally important. Chronic stress can influence blood pressure, heart rate, inflammation, and lifestyle habits. Simple practices such as deep breathing, spending time in nature, engaging in hobbies, maintaining social connections, or practicing relaxation techniques can help reduce the physical effects of ongoing stress. Lower stress levels often support healthier cardiovascular function. Avoiding tobacco products remains one of the most effective ways to protect the heart and blood vessels. Smoking damages artery walls, promotes plaque buildup, reduces oxygen delivery, and significantly increases the likelihood of heart attacks and strokes. Individuals who stop smoking often begin experiencing health benefits relatively quickly, with continued improvements occurring over time. Regular medical checkups provide another valuable opportunity to reduce cardiovascular risk. Routine evaluations can identify conditions such as high blood pressure, elevated cholesterol, diabetes, or heart rhythm abnormalities before they cause serious complications. Early detection allows healthcare professionals to recommend appropriate treatments and lifestyle adjustments that support long-term heart and brain health.